right, good morning, everybody. That was pretty good. So one more time. Good morning, everybody. Good morning. Hey, there we go. Good morning. It's 10 o'clock. I know you all have other things to do today, so I want to be mindful of time, but I'm so excited to see this room filled. This is great. So good morning. I'm very glad to be here. I'm going to share with you some things today, and hopefully it'll clarify a little bit about where we're going, who we are, and a little bit about yours truly as well. So hopefully you'll find it entertaining. I set the benchmark very high. As long as none of you fall asleep, I'm good. But we'll see how we do. So without further ado, we'll get started. I'm going to cover a little bit about my family and why I do what I do. Provide you a little bit of insight into who this new guy is and where I'm from. And how did we get here? Talk a little bit about the industry so that you all know a little bit about what's going on and kind of lay the groundwork for some changes that we're going to go through. And then also look at our change process overview and some of the things that we're doing right now. So without further ado, this is my mom and dad. And this isn't what they look like now. It isn't like I was taken last year. But this is their engagement picture. And so I grew up in central Minnesota, so I am close by. I'm not going to run when there's snow. That's usually one of the first questions I get. I grew up in central Minnesota. My mom and dad were a huge part of why I chose to do what I do. My dad was a turkey farmer, and so we raised turkeys. I grew up in a town of 1,200, so believe me, this feels like a metropolis. You guys have a lot of stuff. My dad was a turkey farmer, and so I grew up really understanding the kind of macro effects of the economy and how it would be for a small business owner. I mean, when the price of turkeys was low and we were about to sell and the price of corn had been high for a while, which would feed the turkeys, we were eating a lot of mac and cheese in our home. That's just kind of how it worked. And so I felt that, I saw that, definitely learned a lot of my work ethic from my dad, put a lot of work into that. My mom was really the heartbeat. My mom actually worked in an alternative education school, so she worked with kids that for whatever reason couldn't make it in the regular high school. Oftentimes coming from really tough home situations where there was either emotional or even physical abuse, alcohol, drug abuse, those kind of things. So that's where she worked. She was a guidance counselor and English teacher there. And so from the time I was probably 5, 6 years old, I started to notice we would get these holiday cards. It'd be Thanksgiving, New Year's, Christmas, Hanukkah, whatever it might be. We started getting these cards from people that weren't part of my family. And so I started to ask my mom, who are these people? I'm sending us cards. I could read at that point. I was really excited to read all the cards. And so I flipped through them, and she'd tell me a little bit about these people, and made me really appreciate what I had, as a family, and some of the love I got, and understanding at a very early age that, boy, some people have a really tough home life and situation. And reading the cards that she would get from these people were really touching. I mean, they put Hallmark to shame as far as what she was able to do to help them in their lives. And they would go on to get GEDs or get their high school diploma or go to college. And she stayed in touch with them forever. To the point now, when I go home, our center island's filled with these cards. And so by the time I was a junior, senior in high school, it was a thing with my mom and I. We'd read, all these cards. And so her work in impacting people played a huge part in what's important to me, and that's helping people. And that's a huge part of why I got into healthcare, is because A, it's the businessy side, like my dad. That part of my brain, I like the challenge of it, the complexities of it. That was always a good fit. But the heartbeat of healthcare, literally the reason why we're all in this building, is to help people feel better, whether it's emotionally or physically. And I want to tell you, all of you, it doesn't matter if you are a bedside nurse or work in environmental services or anything in between, we're all healers. We all have the ability to heal people. It may not just be in the biological sense. So for those of you that are clinically trained, great. We need you, we love you. That's definitely a huge aspect of care, but there's also an emotional side to care that we can all provide. And that can be simply just saying hi to someone, smiling, helping them find their way. Because when people come here, they're typically not in a great space. They're very stressed, they're scared. And actually last year, I went through it with my father. He actually passed away last February from aggressive cancer, pancreatic cancer. And so I was on the other side of that, and I realized how impactful it can be when you have people that just give you a smile, help you get where you need to go, answer a question nicely. It can mean the world in those moments. And so all of you have that power to do that. And so that's why working with you all, being a part of this organization, this community is so special for me, and that's what gives me a lot of energy. I've been hearing now for 15 years you're going to burn out. I firmly believe that's not going to happen because it comes from that place of really wanting to help people. And so I'm very motivated to create a place where we are great at doing that. So the other piece of this equation is my wife, Jessica. Just love her to pieces. She is a family medicine physician, also integrated medicine physician who's going to start practicing here shortly. She's provided a whole nother elements, not only in my personal life, but even professionally, and understand from the clinical side what are some of the challenges that our physicians face right now with healthcare as well. So very excited for you all to meet her, and you'll see us around town walking our dogs, which is a great segue into it's me and Jess. That's our engagement picture. If I got to show my mom and dad, I got to show them. Right, so I talked a little bit about myself, and she's from Pennsylvania, so she's not going to run either. She's good with snow. She's very excited to be here. A lot of fun. We love to travel, hiking, biking, yoga, all those kind of things, which fitted very well with our community here. And so we're very excited to be here. So that's Angel. Yeah, he's our little buddy. I'm going to pick him up today. I was actually out of town last week, and so I'm going to pick him up today. He's got an abnormally large tongue. And I was so excited to capture this picture because it actually shows how huge it is. And so when you see Angel, don't be afraid because it'll come at you. He is a kisser, a lover. He might be a little barky for about 5 seconds, and then he's going to want to kiss you. So, very friendly little guy. He is a Cocker Spaniel rescue. He's got a few enemies I got to watch out and chasing after. He's just intent on chasing these little guys. He does have an anxiety disorder. All of a sudden, late last year, he started doing this thing when Jess and I would leave and go anywhere that didn't include him. He'd start to shake, and he'd tremble, and of course it just broke Jessica's heart. She could barely leave anymore. And so we decided, you know what we should do? We should give him a buddy. So, so we got him a buddy. That's Sammy. So Sammy's also a Cocker Spaniel rescue. He had a really rough go of it. We were really excited to get him. He honestly, when we got him, he hadn't seen the outside when we actually rescued him. So being on grass was a very new thing for him. But he's adjusting nicely. We've had him for about a year now. And him and Angel, they get along all right. It's not an ideal situation. Angel really likes being the center of attention, but Sammy does keep him company, so he actually doesn't have his anxiety as bad anymore. So that's Angel and Sammy, and that's my family. So let's transition a little bit, transition into the industry and what's going on in the industry. So what I've gathered in talking with a lot of people in the community and some of you in this room is that there's a lot going on in healthcare that, for a large part, we've been sheltered from here, more so than in some other areas of the United States. I can tell you right now, though, these things are hitting us. That while it took a while for it to get here, it's now here. And that being part of United States healthcare is wrought with challenges. So I'm not going to spend a tremendous amount of time, but you can see all of these things are challenges that we're dealing with right now. And the primary one up top is declining reimbursements to run hospitals now. It is a tremendous challenge. From 2009 to now, we've seen hospitals actually close at a rate we've never seen in the United States. Over 70 have closed since 2010. I read an article last weekend that suggested over 20% of United States hospitals are at risk of that in the next 5 years because they can't make ends meet from a financial standpoint. And so the industry is really in a state of change right now in figuring out, okay, how do we make this work? Now, I don't know if you realize it, but there is an election when we vote tomorrow. I mean, you've missed it. I don't know how, but we haven't heard much about healthcare, which has been really disappointing for me because we've got a lot going on in the industry, and I wish there would have been more time devoted to that because there's so many people that work in our industry that are dependent on the industry, and we need some help at the federal level to understand what we need to do to provide great care, great service, and great outcomes. There needs to be some normalization, some healthy discussion about how we get there as a nation. So just so you know, these are just a few, and there's a lot going on, so I wanted to hit on a couple of those pieces. And then it's been going on for some time. You go back to 1965, that was the first real big transition where we actually created Medicare and Medicaid. That was huge. I couldn't imagine that passing in today's political climate, but it did. And that was the first time when we actually set out to create a system where it wasn't going to be what the cost of care was anymore. It was going to be you're going to get a grouping payment at that time. Here's what it's going to be. Bill Clinton's Balanced Budget Act in '97 was another big reimbursement hit. I heard from a number of the doctors that that was kind of the time, the first time where Marquette felt a big hit. Some of you are nodding right now, right around then, because they went after heart programs, more so hit the reimbursement there. So that really hit us, and then the one that we're all still dealing with, which has just accelerated it so much, is the Affordable Care Act in 2009. The ripple effects of that are still ongoing, and it's created a lot of pressure in the industry on primarily the financial aspect of it. And one of the authors, Ezekiel Emanuel, who wrote it, or is one of those that wrote it, actually predicted at the time that they thought about 20% of U.S. hospitals would close as a result of this. So it isn't like it was unbeknownst to them it was going to create challenges. They knew it would, because as a nation we have to reduce our spending as a percentage of our gross domestic product. So it's going to remain a political hot potato for a while. This year it just got dwarfed by all the other noise we're dealing with. But it's a big issue for us as a nation to get our arm around. Now, since 2013, there's been $24 billion in cuts to the hospital industry. And it hasn't been the cost curve at all. So, and we also know in the next 6 years, we've got another $70 billion in cuts coming. And so I share this with you all because we are part of this. You need to know and you need to be informed about what we're dealing with nationally. That this isn't a Brian thing, this isn't a Duke LifePoint thing, this is just U.S. healthcare. And a lot of hospitals right now are dealing with this, and the different payer models based on performance and some of those things. It's putting a lot of pressure on hospitals. So you're seeing two things, either they close or they're joining a big system to help them out. That's really what's going on. And so we did that in 2011, right? We joined Duke LifePoint. And so that was certainly fitting in with this. So now, here's the implications about this. It's created a really unhappy industry. I have relatives who are nurses and work in hospitals. There's no one who I'm talking with across the U.S. that is skipping to the shower with joy in the morning about healthcare and what's going on and all the great things that we're doing, because what this pressure has created is unfortunately sometimes a disconnect between why people got into healthcare, which is to have, focused time with patients and some of the things that we didn't have to talk about before, now we're having to talk about in a much different way. And it's forced healthcare, which had largely been, really not part of the broader, you could have economic ups and downs and somewhere in between, but hospitals were fine. They didn't really go away. The economy could go sideways, but hospitals were fine. That's not the case anymore. So now hospitals are starting to act more like businesses. There's more of a business acumen that hospitals have to have. So that's where we are. So there are only two things that I hate. This cute little kitty who looks a little upset. Change and the way things are. That would probably summarize where we are as an industry. So it's painful. A common quote you hear is do more with less. That is the state of our industry right now, and we are trying to figure that out as rapidly as possible. So that is the state of the state. Now that's the sunshine and rainbows part of the discussion. So we're going to transition into our organization. What I have to share with you is it's a new day. Ladies and gentlemen, it is a new day. I understand, I've heard from many of you loud and clear, things have not done perfectly the last few years. I've spoken with a number of people in the community, a number of you, a number of our physicians. I get it. And we own it. It is what it is. It's where we are. And now it's time for us to turn the page and reposition ourselves to thrive and be ridiculously successful here for a couple of reasons. One, you've got a great organization, very unique provider of healthcare for the UP. I mean, we are it for the UP as far as having depth and breadth and quality of services. And you talk about our community being invested. I've been around. This is the 43rd hospital I've worked in executive capacity. A large number of those were all in the U.S. and consulting basis. But this is the 43rd one I've been at. I've never seen a community as tied into the hospital as this one. That's very unique, and I love it. It's great. We're really a big economic engine. We have to be great for this wonderful community to continue to thrive and be as great as it is. They're relying on us to get it right. And so we need to collectively turn the page on what was, and let's go forward. Key to that is a new day. All right? So, what does that look like? I want to provide just a quick framework of what that looks like for us, because we are on a journey now towards becoming a high-performing organization. Those organizations that people nationally look to and say, wow, look what they're doing in Marquette. Now, this isn't my idea. I want to be very clear with you all. This is not my idea. This actually came from our board. So I held a 2-day retreat with our board. I held a 5.5-hour session with 21 of our physician leaders. And they have told me loud and clear that they want to be that. And actually I'm finalizing this, what we're going to be, who we're going to be process, our vision with our employees. I've got 40 employees who I'm going to meet with on Thursday afternoon to finish this work. Okay, and then in January, I'm going to share with you all, here's what we're going to be. But I can tell you, resoundingly and very consistently, we're hearing from all these constituents, they want to be a regional provider of healthcare and be one of the best of the best. That came through from everyone. So here's what that looks like. So right now, here's where we are. Everyone agrees we're somewhere in between these two. And this is struggling and this is stabilizing. Okay? It just is what it is. It's not where we're going to be for long, but that's where we are. We've got some aspects that are working all right, some that have not gone well of recent. So we are moving to get back on mission as soon as we can. And once you get to on mission, then you're really executing on strategies. You got good engagement. People feel good about where we're going. You start to see some results come in from a quality service engagement standpoint. And you start to feel, okay, we're moving. We've really got this. So we're moving quickly as we can over to this part of the equation. Then we look at that breakthrough to where we get to a high-performing organization. This is what it looks like once you get there. That's when you start to perform on a national level for quality service engagement standpoint. Those are really the big 3 items that we'll be focused on. The financials, you get all that stuff right, the financials come. You don't have to worry about that. But we get our engagement right, our team focused, us spreading good messages, that all translates into success in high-performing organizations. So that's where we are right now. But the first thing we have to do is establish a vision. And so what I talked about before, I've held 2 of the key informational sessions so far. The last one is this week. We're going to finalize that work, what our vision truly is and who we're going to be. And then we're going to go forward with that. So in January, I'll hold another one of these. And I can't wait to share it with you. What exactly it is that we're going. But this is the journey. No question it's high performing. That discussion will just get around what will that look like as we go there. What is going to be our real focus areas in the near term. Because this is a multi-year journey. This isn't a couple months. This isn't something you can do that quickly. This is a multi-year journey. Okay? So that's the process. So when you talk about transformational change, here's a couple of pieces that I also want to share with you from a framework standpoint. Number 1, got to get the right leadership team in place. So you've seen there's been some changes so far, even since I got here. Got to get the right leadership team in place. Then we move into culture. And that's something that is ongoing now. And this is at the center of the slide for a reason, because that's the heart of everything that we do. Providing outstanding quality and service. And like we talked about at the outset, we can all do that. Because there's benchmark clinical quality, but there's also service. And we can all provide great service. Okay, so we are all in this together. And so that's the real focus. You get over here, then that leads into, okay, strategy and growth and those kind of things. But you do this right, all this stuff comes. It all comes. This is more of a lag indicator of what we're doing here with people that are here right now today. People want to come here, they have great experiences. They're going to want to come back. They're going to tell their friends, they're going to tell everyone else. Now we're going to put strategies in place, and we're going to work on those things, but really the heart of it is quality and service. Okay? So, moving into the leadership team redesign, we've got some new people on board. We've got Suzanne, would you please stand up, our new Chief Nursing Officer? Please stand up. Please give a warm welcome. So excited to have Suzanne here as our Chief Nursing Officer. We also got a new Chief of Staff, Sharon Radcliffe. She actually got married this weekend, so she couldn't be here today. But will you please do me a favor? When you meet Sharon, and you'll see her around, ask her where she parks her car. Only because she's got a bit of a British accent, and it is the most adorable thing when she says the word garage. Just trust me on this. Just ask her. It will add a little sunshine to your day. New Associate Administrator, Mary, please stand up. Very, very excited to have her on the team as well. New COO, our national search is underway. I've got a couple of applicants that I'll be phone interviewing this week, actually former CEOs, because I'm really looking for someone with really strong experience that can really add a lot of talent and experience to our leadership team here. New Quality Director, welcome Jake Reddy. Jake, please stand up. And we've actually got a new physician recruiting department, and we're going to be adding a director to that. A critical element of what we do is recruiting physicians as well as our team. So we've actually got a new HR leadership national search underway as well. And so right now, we're really focused on that recruiting retention piece. Not only recruiting our team and our staff, but also doctors, and a core aspect of that is retention. Just to give you all a little bit of perspective on what Teresa, a one-person shop, has been able to do for physicians. In the last 4 years, she successfully recruited 104 doctors. So hopefully that dispels the rumor that we can't recruit here. We can recruit here. Our challenge has been retaining. We lost 96. So we're +8 in 4 years. Now that is a product of not having the right infrastructure in place to get the right people. There's an element of it, you gotta get the right person. Because there's definitely a lot of doctors right now with all the challenges out there at the U.S. healthcare, where there are some on more of a, they'll go someplace for 3 years, sign a contract that's really big, and then they go to the next place for 3 years, sign a contract that's really big. So there is an element of that. We have to get the right people, and we've got to be able to retain them. So we're really focused on the retention piece as well. You can see a new physician integration specialist. She actually starts today, who's here, and her focus will really be on integrating these new physicians into our medical staff and to make sure once we get those physicians here, we don't lose them. Okay? So we're also looking at adding some process improvement talent to help us out with our processes. What I've heard from a number of you is that we've really covered up process deficiencies with just more people. You know, we just throw people out, but then if you change shifts, if Michelle's not covering a shift, and it's Mary instead, Mary does it totally different than Michelle. So then you've got deviation from shift to shift, and that creates a different care experience, allows yourself more opportunities to make mistakes, right? And so we've got to focus on process improvement too to help us out. Because as you saw before, a part of the industry right now is we have to be efficient. Okay, so we've got to get our processes right, so it isn't so reliant on you and your brain amidst a wild and busy day to remember all the minutiae. It's a process. It should be about process, not the people. Okay? That would be a real focus for us going forward. So, culture. As I mentioned before, Sharon's here. a big part of her role will be focusing on our culture. And so we are in the process of setting up what we're calling culture days. And so they aren't on the schedule just yet, because we're working on that. There's some work that we need to do, and Sharon just started, so we want to give her a couple months to be able to talk with you and understand what we need to do. But I've worked with her before in this capacity. She's one of the best I've ever seen do it. Actually a former chief nursing officer. So very excited to have her here. We're going to be very focused on our culture and connecting with our people and engagement. Again, that's a lead indicator for me. We do that part right, the rest of the stuff will follow. The financial component, all that stuff will follow. If we're all connected and making sure that we're focused on the right things. So, Leadership Development Institute is something I'm starting here for our leadership team, to put them through some formal training. I recognize that across the industry, one of the things we have not done well is train leaders. Oftentimes a bedside nurse just becomes a charge nurse, and becomes a manager, and becomes a director, and there's no training in between. And that's a tough task of anyone today. And it doesn't matter what department it is, that's often how it works. You just kind of work your way gradually to the top. And right now, with all these challenges in healthcare, the expectations of a director and manager are very different than they were a decade ago. Very different. So there needs to be training, so we're bringing that to our leadership team. Leader Physician Fellowship is actually kicking off officially this Thursday. So we've got 12 of our physician leaders who are in a formal fellowship program, an 18-month program that is focusing on leadership. One of the things the industry missed is that leaders on the physician level are far and few between. And they needed training too. They come through med school, they don't talk about leadership or working with people or problem solving as groups. That's not part of their training. They're in a hyper-competitive environment where they're focused on themselves and making it, in a large part, a number of my friends, surviving. You survive med school, you get out. And then you're in this team dynamic. You know, healthcare is talking about teams, talking with people. You know, that's a different skill set. We recognize that we're actually one of 3 pilot sites in Duke LifePoint that has this engagement going on, which is really exciting stuff. So we've got 12 of our physicians going through this formal training program over the next 18 months. All right, so some core services that I'm focused on every day. CV services, general surgery, GI, pulmonary care, ICU, all big issues there that we need to rectify immediately. And so they all have their different flavors and nuances, but those are some of the key pieces that I'm working on each day. Strategy development, that's part of the vision process. So for us to be a regional provider, I feel we need to have a more robust primary care network. What I call up here ambulatory primary care across the UP. And if we're going to be that regional provider, we have to have more primary care clinics across the UP. I've driven it, I've seen it, and there's a lot of room out there for people to make other choices other than Marquette. You know, you go out to the Sioux, that's a healthy drive. That one straightaway, I think that should be a pilot market for that Google car that can drive, because I don't know how you mess that up. It is straight as an arrow the whole way. So this is a big part of it too. So what right looks like. Commitment to excellence is something you're going to be talking about a lot. Mediocrity is something that just is not okay anymore in healthcare. We are being held to a completely different standard than even a decade ago. Why is that? Transparency. The advent of online media. Some of these new pieces that we're dealing with, there are so many healthcare organizations right now that are trying to get in the lead position for determining what is good in healthcare. If you're a good doctor, if you're a good hospital, there's at least 50 of them. I did a search last May, and there were 55 websites that were now developed and live that say what a good doctor is or what a good hospital is. All with different criteria on how they get there. And a lot of it, you have to pay to find out what their criteria are. So it's really challenging, and it's very frustrating that you can have these organizations where you don't know what the criteria are. They're out there talking about you. Because they're taking claims data, and they're telling you if you're good or bad or indifferent. And so that is very challenging. So being mediocre in healthcare just doesn't work. It was never anyone's intent. I've never been in a hospital where, oh yeah, we're okay with it. But the great organizations They have that in what they do every single day. A quote that I love is variability in results is simply senior leadership's tolerance for mediocrity. That resonates with me because it's so true. It is so true. Some of these organizations I put up here, I've had the privilege of working with and for. And you talk about some of the best of the best, they have this as part of their fabric. And I can tell you right now, these organizations have challenges too. There is not a perfect hospital or system out there. There's not. They have challenges too. What they do very well is they celebrate their successes and build their brand. And then they commit to fixing things that go wrong. And they have a low tolerance for poor performance. That's just part of how they roll. You just don't sit in the room at Mayo Clinic if you're okay with the mediocre results. You should be very passionate about that. You should want to help people drive outstanding care and service every single day. That is what makes those organizations different. I don't think they're necessarily smarter. I don't think they have better doctors, better nurses, better team. What they do, though, is set the mark high. And they create an accountability and discipline and an engagement around being the best of the best. And they rally everyone in the organization around them. They walk with some pride. They have some swagger in what they do. And I'm okay with that. And it's a good, healthy thing. I can tell you a number of people in the community have told me we lost our pride. We're going to get that back. That's coming back. Because that is how you thrive long-term in healthcare right now. And that is what we have to do. Our community is depending on us. And the UP is depending on us. That's what I feel very passionate about being a part of and privileged to be here to help lead that change. Okay? So, next time, what we're going to be chatting about next time is our vision. As I mentioned, I've got one more to hold. I want to make sure I talk with our employees around that as well before we go public with it. Team redesign, so talking a little bit more about leadership team, where we're at. We're going to talk about culture, quality, and service, because at that point we will have scheduled, if not held, one of our culture days, or a couple weeks of those culture days. Strategy, and where we're going. And that'll be the agenda. So you all know next time, take a picture with your smartphone if you need to. Hold me accountable. This will be our agenda for next time. I want to give you an update on where we're at with these key things. Okay? So, are there... Yeah, I did the bold thing. So, I ran 5 minutes over, and I'm sorry for that. But are there any questions, reactions? Please, this is our time.
Reaction? How exciting. Thank you.
Thank you for sharing. I am excited because this is a remarkable opportunity we have. This is a remarkable community. My wife and I have been around. We've moved a little bit. Thank God she puts up with me moving. We love it here. We fell in love with this area in 6 days. We made the decision, we're absolutely coming here, and we're going to buy here, and we can't wait to walk our dogs on these trails. And the people here are so nice. I love Donkers. Oh my gosh. their ice cream? Oh. I might have to get some new clothes soon. But I got to get up and do a lot of walking, I guess. But no, thank you. I'm so excited to be here. This is going to be an exciting time. I'm so excited to work with all of you to accomplish this, to become a high-performing organization, because what a remarkable story it's going to be to tell about what we decided to do and then to do it. Our community will be thrilled. And to have us nationally recognized, how cool is that? That positions the entire community for ridiculous amounts of growth and success. And that's what I'm really passionate about. Anything else?
You weren't in on the planning of the new hospital. I'm sure you went over the blueprints and everything. How do you feel that meshes with our progressing vision?
Yeah, awesome question. Just in case you couldn't hear it, she asked about the hospital and how does that fit in with our vision. I didn't leave that out by mistake, by the way. I recognize we have an amazing $300 million investment that's now going up. That looks pretty cool, right? See it go vertical? That's pretty exciting. That is really exciting. The reason I did not mention that is I realize there are more pressing issues and concerns that we likely all have. And so I did not want to make that the focus right now. However, what a great thing. And so how does that tie into where we're going in our mission vision? It fits in perfect. I mean, what an asset. I've seen the renderings. Oh my gosh, you guys, it is beautiful. It is beautiful. What I recognize, though, that we need to get us all on the same page and excited and passionate about our vision, our quality of care, our service, and get us speaking positively about what we're doing, because we're going to bring that to the new hospital. So my real focus is to get us ready, to start moving along that journey, get us to on mission and get us ready for the breakthrough before we get there. That's my focus. So it fits in perfectly from a strategic growth standpoint. That's going to be a big deal. When we open up that, there isn't a competitor within 5 hours that has that kind of a asset to be proud of and to be excited about. No one can touch it. No one can. But is that going to be all we need to do? No. We need to not only provide outstanding quality service and get our engagement scores up, get people excited about what we're doing here, we also need to build up the primary care clinics across the UP to feed our specialists here. So they're busy. And so they're growing. As we grow, the community grows. It's a good thing. As we grow, we pay more taxes that go right back to our community. That's a good thing. And our community is really dependent on that. So it absolutely fits in nicely with what we've got. Thankful, I'm so grateful and thankful we have that already locked in stone. Basically 2 years from now is when we go live with that. So that's a great piece of our strategy, a great component that fits in really nicely with what we're doing. Anything else? Yes, ma'am.
Since you're the new CEO, you said you've been in how many hospitals?
I've been at 43.
Is there a reason why you think it's so much?
That's a great question. And thank you for asking that. Let me talk about that in a second. So this is the 7th one I've worked in where I'm day in, day out here, part of a team. So the other 36, I was in a consulting advisory capacity. So I was all over the place. When I was there, though, I was like a sponge, because when I'm at the Mayo Clinic, I wanted to figure out how they worked. I'd round at midnight. I wanted to figure out what makes them different. So I got a lot out of it. But this is my 7th official hospital. So why I moved that much? It's a great question. Opportunities. You know, that's what's really happened. Thankfully, I've been very fortunate to have great mentors that have kind of given me the get out the door, go, do more, take on more responsibility. That's, you know, what happened here, where we needed a leadership change. And so when they presented it to me, I was not thinking or planning of leaving where I was at. It was my 3rd CEO position. I was very comfortable where I was, but again, my wife and I came up here. We loved it. I talked to a number of people because it was great. When I was here for those 6 days, I could wear my Batman hat. Nobody knew who I was. So I could get a lot of good intel. People were very honest with me about that. You know what? It just resonated. I thought, you know what? This community is very special. I believe I can help. And I really wanted to come here and bring my passion and energy to this great area and to this team. To help. Yeah.
Along those lines, I think from when this healthcare organization went from public to private, we've seen a lot of executive changes, executive staff changes. Is that more of a function of opportunity, or is that something that will stabilize more? Because we've seen different visions for every couple of years type of thing.
Yeah, no, thank you again for bringing that up. I really appreciate that question. I honestly, guys, I cannot imagine the emotional state that you're in being on number 4 in 4 years. Why should you think I'm any different or I'll stay? I get it. I own it. That question is so real and honest, and it's something that I don't have a magic arrow in my quiver to say, oh, a new day, it's different, I'm going to be here forever. It's going to take time. to build that trust. Is it normal? Absolutely not. I've never seen it before. And it was one of the questions that gave me the greatest pause about coming here. Because I knew that, gosh, I'm going to be ice skating uphill for a while. You know, just getting people to trust and believe and, you know, those kind of things. So the only thing I can be is myself, be candid with you all about what's going on and what time we'll get there. But it is not normal. It is not what you expect. And I sure as heck plan on being here for a long time. I'm my wife. It wouldn't go well. So, I'm not messing with family, so, yeah. Yes, ma'am.
Can you talk about meeting with the board and meeting their position? I'm going to be meeting like staff meeting, like what type of staff meeting and how the group came together?
Yeah, great question. The staff meeting I have on Thursday, how the group came together, or the selection was made, I put it out to our leadership team. Find me people that are high performers in your department. But I wanted, the only criteria I put on it was that they're regarded as a high performer, someone who's engaged, and that they're multidisciplinary. I wanted someone from most every department here, so that we weren't just getting, you know, one constituency and leaving out others. I wanted someone who represents a group that represents everybody, you know, pretty well. And so while it'd be great to get a group of 2,300 together, it'd be very hard to lead that meeting and actually get anywhere. So it's a group of 40 that should represent most of the hospital. So I'm very excited to speak with them, share with them what we've gotten so far, and see what they can add or amend and get their feedback. So, great question. Yes, ma'am.
Well, I guess you could see that when you talk about the hospital, there wasn't a whole lot of excitement expressed by everybody. We're all a little bit anxious about who's going to be here and who's not going to be here.
Yeah. There's definitely a palpable sense, which is so sad when you think about it, that you have this $300 million investment. There aren't many of these going up in the United States, guys. I mean, we're one of a few that has this kind of opportunity. It had gotten dwarfed by all the kind of anxiety and fear and some of the things that hadn't gone well. And I get it. And it's sad. We'll get back to that becoming our focus, and that's why I didn't talk about it today. I want to talk about things that I think are most important and resonate with many of you. It's, A, who am I? Because you've seen a lot change. And 2, what are we doing? Where do I see us going? Those are the 2 things I wanted to leave with you today, to give that sense of direction and stability, which I know an aspect of that will come with time. But that's what you should expect going forward. We'll start getting excited about the hospital in due time. But right now, I feel it's most important for us to get that direction, a shared vision. Not just coming from me or Duke Life Point. It's from us. A shared vision, and let's go. And share that plan with you. And let's do it together, because it is about us together. It's not the Brian show. It's us together. I need your help. I need your help to do this. You know, you all carry a very important message. There is no better branding or marketing opportunity than what's sitting in this room. Your family, friends, and others are going to choose us for healthcare if you go home and say, gosh, there's some great things going on. And right now, our internal market share has dropped a lot, just from our own Marquette zip code. That's people just saying, you know what, there's a lot of dysfunction, we're leaving. We have to change that. It's not going to be a billboard that we put out. It's us in this room committing to that, because we don't have a choice. We grow, it helps the community, there's more jobs, it's healthy, it's prosperous. If we don't, if people continue to go elsewhere, we will contract. We will have to cut staff. We will get smaller. That will impact the community. Our tax revenues will not be as generous to the community. That's a dire situation for the community. It is imperative that we get that right. And I want you all to share that responsibility in this journey. It's going to take a lot more than me just going out in the community and talking and doing the things that I need to do. Nothing will turn us around faster from a growth standpoint than what's in this room. Speaking positively about where we're going, what we're doing, celebrating successes. So one of the things you can expect from me by January 2017 is a weekly or bi-weekly items of excellence email. Things that I'm hearing that are going really well. And I'm going to be asking you to share those things. Because there are great things going on here every day. Now, unfortunately in healthcare, and it's not unique to us, we get focused on gosh, we made a mistake. Oh my gosh, and it's horrible when we do, and everyone involved with them feels horrible. And we need to fix those, and we always will. Those great organizations have those things happen too. But they don't solely focus on it. They still celebrate the wins and the accolades and make people feel good about what they do every day. That's what we need to do. So you're going to start hearing a lot more from me and the team around those items of excellence. Things are going well. Because we need to share those messages. Yes, sir.
Is there an avenue for an employee influence? And share our suggestions, what we'd like to see as well. Is there an avenue for that yet?
Oh, absolutely. Yeah. I mean, email me. I'd love to hear from you all. Your direct line should be whoever your manager, director, supervisor is. You should be able to share those things. When our leadership team is functioning at a high performing level, you should be able to share those suggestions with your direct supervisor, manager, director, those who go directly to their reporting officer, and you can make decisions and changes like that. Human resources, always a good place to go. But you'll always have those avenues, and you should always have those avenues where if you have suggestions how to make your department better, the hospital better, we want those all day long. You should be sharing those with your leader all the time. And if that's not happening, it needs to. That is part of a high-performing organization. You've got to be able to share. A lot of our best ideas will come from you. You live it. You know the department. You know how things flow. Your process improvement ideas should be better than something that I would come up with. You know your department. So some of the best ideas will come from you. Those have got to be going to your direct supervisor, manager, director. You can always email me. That's really the most effective and efficient way to get things done. Okay. Yes, ma'am.
Are you ever going to have like a public forum so people can figure out what you got?
Yeah. You mean like in the
Get to know
community?
you and,
In the community?
yeah.
Yes, I've been doing those in more of the groups. I'm trying to think of yeah, Rotary and Kiwanis. I've been doing those groups so far. Next year, part of our marketing plan, I was talking with Victor about a few minutes before we got started, is having those be hopefully a broader audience or bigger audience. I try and get out whenever I can. When they invite me, I'll do it. I love doing that, and I think it's really important. So, but thank you. Yes, I am going to be on the road as much as I can.
They're even here sometimes. I think we do things at a public forum here and like everybody.
This is a great forum for it, right? I mean, you get a couple hundred people in here. I agree. I totally agree. I think it's really important that we connect with our community. And again, I just want to emphasize, the people in this room, if you're able to share good things, nothing will turn it faster than if we all walk out of here excited about where we're going. Nothing will turn it because they expect it from me. Just by default. I do that. They expect it from me, and that's fine. That's important. But what will really impact people's decisions and where they choose care, there's no more powerful marketing tool than us right here. So it's largely in our control. Anything else? I'm sorry, we're really running over. 20 minutes. Anything else? Thank you. You all have been a fantastic audience. Thank you so much for coming.